Welcome to Your Health. I'm your host, Rhonda Alfred. Joining us on this episode is Dr. Gennaro Goffin, medical oncologist at Terrebonne General Mary Bear Perkins Cancer Center. He's going to be talking to us about melanoma awareness. Welcome to the show, Dr. Goffin.
Thank you, Rhonda. Thank you for having me. Thanks for the invitation.
Well, thanks for taking time out of your busy schedule. I know we have an important topic to talk about today, but before we get started on that, tell us a little bit more about yourself and your role at Terrebonne General Mary Bear Perkins Cancer Center.
Well, as you guys know, I'm Dr. Goffin. I've been here working for 4 years now. I'm a hematologist oncologist. I treat blood disorders, and at the same time, I'm a general oncologist, treating mostly breast cancer, lung cancer, colon cancer, kidney cancers. But in today's topic, we're going to focus about a couple of my patients that are having a bad cancer called melanoma.
All right, well, let's get started with you telling us about what is melanoma and what are the primary causes.
So melanoma is a fancy term to say skin cancer, one of the worst skin cancer. There's multiple skin cancer, but melanoma is the worst one to have. Is the 5th most common cancer in the United States, affecting males and females at the same time. And basically, the people who are most affected with this diseases are mainly white people, people that are blonde hair, red hair, with a lot of freckles in their skin, and they get a lot of sunburn exposure, sun damage, basically. Also, other people are family members. If there's positive family history, that's another important.
Okay, so what are some signs, some common signs and symptoms that you might have melanoma?
Well, that depends of the location of the melanoma. Usually stage 1 disease is basically in the skin only, so it can present with just a mole that is getting bigger, right? And it's getting uglier with different colors, and it can be bleeding. So a sign could be signs of bleeding in that mole and itchiness. When there's 2 or 3 disease, means that this cancer cell has spread to the lymph node, so you might have lymphadenopathy in the axilla, as an example, or bumps in that area. And in stage 4 disease, it means that the melanoma has spread inside of your organ. So depending where it's spread, you're going to present with signs and symptoms of gastrointestinal bleeding. If it's in the brain, it can have seizures, or if it's in the eye, you can have vision issues and stuff like that. So it all depends where it's located, which part of the human body.
I think the common conception was that it's something visible on the outside, but we didn't realize that it's something that's inside as well.
Yeah, especially in stage 4 disease. And melanoma, I like to point out that melanoma is the only cancer that is the most tricky one, because it can be literally in any part of your body, anywhere. Like it can metastasize anywhere, like eyes, nails, gut, brain, everywhere.
Gosh. All right. Well, what is the ABCDE rule used for?
So ABCDE rule is basically really popular that medical students even they teach them, to the medical students. So A is asymmetry borders, basically. And then C is the colors. Asymmetry is the A. B is the irregular borders. And then the D is the diameter, that is more than 6 millimeters. And then E is evolving, like evolution of these lesions that with time they get bigger, uglier, different colors. So it's evolution or evolving. That's what it means.
And what are the different types of melanoma? I know you explained some of them, and how do they differ in terms of treatment and diagnosis or prognosis?
So different types of melanoma, the most common ones, the number one common one that is 70% is called expanding superficial melanoma. Then you have the nodular melanoma, which is it arises from nodules or pimples. The other one that I said before, it arises directly from the skin. Then the lentigo melanoma is from previous sun damage. And acral means in the nails, that arises from the nail, and uveal from the eyes, basically. So those are in general the types. You told me about prognosis. The worst prognosis one is from the eyes, uveal, and from the nails, acral. And for treatment options, you have surgery, you have radiation, and then when it has metastasized as a stage 4 disease, usually we use immunotherapy target therapy, and as a last resource, we use chemotherapy.
So how important is early detection in the outcome for the treatment of melanoma?
Early detection is crucial because as we do an early detection with annual skin exam by a dermatologist or family doctors, we detect early stages and we improve the outcomes of the patient. As an example, in 5 years, a patient diagnosed with a stage 1 melanoma has a 99% chances of survival. If you're at stage 2 or 3, you have a 75% of survival. And if you're at stage 4, only 35% of survival in 5 years. So those numbers matter, right? So early detection is key.
Right. And what advice would you give someone to prevent melanoma and minimal skin risk?
My best advice will be if you like to tan in the pool or in the beach or your work, based on your labor, you spend a lot of 12 hours, 10 hours daily on the sun, is to use sun protection, right? With SPF, good high SPF. Also wear long sleeves, wear a hat, sunglasses, stuff like that. That's basically what dermatology recommends to prevent melanoma. And also do an annual skin exam based on the family history and everything,
Okay. So what services does Terrebonne General Mary Baird Perkins offer for individuals for early detection?
So recently in April 21st, there was the Big Brims. Another one that is good to go is Prevention on the Go, which is multiple events during the year in the community to do any cancer screening, including the skin annual exam. And the last one is called Live Well by You, which is kind of similar to the Big Brims, basically.
It's
based in November, I think. It's in November.
Opportunity for early detection.
Exactly. That's what matters. That's the best. That's our best weapon, early detection.
Okay. Well, thank you so much for joining us and providing this helpful information.
Okay. Thank you so much, Rhonda.
For more information about Terrebonne General Mary Baird Perkins Cancer Center, visit marybaird.org/strength. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.